Now to the adjournment. The whip to move.
I beg to move that this House do now adjourn.
Thank you. The question is that this House do now adjourn. Yvette Cooper.
Thank you, Mr. Speaker. And can I wish departing members a good summer and thank Mr. Speaker for giving me the final debate of the session before the summer recess. Can I welcome the new Minister as well to the dispatch box, who will be replying shortly. Mr. Speaker, I called this debate following the debate a few months ago called by my honourable friend for Dewsbury, because she and I and many Yorkshire members are deeply, deeply concerned about the staffing levels, not just at Mid-Yorkshire Trust, but also at other hospitals across Yorkshire. And our health service is being seriously affected. We have warned ministers about this before, but we are deeply concerned that nothing is still being done. And things will get worse if action is not taken. Last year, I was contacted by my constituent, Mr. Fanshawe. His mother-in-law, Edith Cunningham, had recently died at the end of a short illness in Pinderfields Hospital. And as well as dealing with the grief and the bereavement, Mr. and Mrs. Cunningham were also having to cope with the deep distress and anger at the way that Mrs. Fanshawe's mother was treated and the care that she received in her final days and hours because of serious staff shortages in Pinderfields Hospital. Nursing staff were so overstretched that at one point she had to wait 2 hours for a bedpan, 2 hours for an elderly lady in distress. At one point at the weekend, she had to wait for 25 hours to see a doctor. And it became clear to the Fanshaws that there were such staffing shortages on the ward that they felt they could not leave her, so they stayed. They did her bedpans, they fed her. When the pressure mattress that they'd asked for was brought up, there was no one to change it, so they changed it themselves. Now, I've met with Mid-Yorkshire Trust, with the Fanshaws, and the Chief Nursing Officer there has given them a full apology for what happened and made clear that this was an unacceptable level of care as a result of the staffing shortages on Ward 43 at the time. Since then, the Trust has continued to work on a wide range of different recruitment and staffing initiatives to try to improve the situation.
My right honourable friend give way. I thank my right honourable friend for giving way and also for calling this very important debate today. As she alluded, I had a debate on this very issue in March this year, and sadly it would appear that very little progress, if any, has been made. Last week I attended a patient safety walkabout in Dewsbury Hospital on Ward 2, and once again patients raised a number of issues of short staffing. In fact, one patient was told not to ring her alarm bell at night because there was only one member of staff on duty, and I heard that from a number of patients. And equally, the ward had been extended once again. The capacity had been increased from 24 to 30. Sadly, no extra staff had been brought in to accommodate those extra patients. So I would plead with the Minister today, we really need to see some tangible progress on this issue to make sure our patients are safe.
No. Well, my honourable friend is exactly right, and that is the examples that we get, the cases that we get continually now from constituents, and very often saying the same thing, that the nursing staff are wonderful and look after them and work immensely hard, but they are simply overstretched. There are simply not enough of them to do the job that they want to do. The Trust has recruited not just locally but from across Europe and from India. Sometimes that has raised language issues as well. They are looking at new ways to recruit from the local area too, and in some areas the number of vacancies have fallen. They've also put in place processes to try and switch staff around to make sure that gaps are filled every day. And I do welcome the commitment by the Chief Nursing Officer, by the Chief Executive, to do everything they can to fill the staffing gaps. However, it is still not enough. And we agreed with the Trust that the Fanshaws and the local Health Watch should be able to do an unannounced visit to Ward 43 and to talk to parents and to report on what they found. And let me quote from their report. They said, "Patients reported kindness and very good care. Patients generally agreed that staff are lovely but are run off their feet. They found that staffing levels were better than last year, but it is still often a struggle, and only rarely does the ward have the right quota of staff." And just this week, I received another email from another family, again with a relative in Ward 43, again raising serious alarm about the level of staffing on the ward, about the level of care that their relative is given. Basic care, basic support, not enough healthcare assistants, not enough nurses to provide the care that is needed. And it fits too with the findings of the Care Quality Commission last year, who have also raised concerns about safe staffing levels. And once again, we cannot say enough how much we should pay tribute to the hard work of the staff at Mid-Yorkshire Trust and the kindness that they show, the work that they are doing. However, when they are stretched in all different directions, in the end it is the patients that lose out and the staff who also are deeply concerned that they are not able to provide the level of care that they want. And I'm concerned too about the financial pressures on Mid-Yorkshire Trust. They're not the only trust where the money they get is simply not enough to meet rising demand. And the Minister, I suspect, will have been briefed about some of the financial pressures and the squeeze facing Mid-Yorkshire Trust now, and the risk that services are being cut, not for sensible medical reasons, but simply because they don't have the funding or the staffing to provide them safely. And I think it's worse than that too, because even where Mid-Yorkshire Trust has budgeted for the staff, they cannot recruit enough or retain enough to deliver the services in the way that they want and the way that our communities need. The latest figures from the Trust list 150 nursing vacancies. That includes healthcare assistants and safety support workers. That's about 12% of their budgeted posts. There's a 17% vacancy rate for nursing staff in the theatre department and a 20% vacancy rate in intermediate care. If you take account of holidays, maternity leave and sick leave and stress and temporary secondments to other departments, the gaps are bigger. So from the monitoring by department in May, looking at the actual staffing relative to the planned levels that they wanted, cardiology is only at 76%, stroke rehab is at 65%, short stay is at 70%. The Trust also measures unavailability. Well, that is the percentage of contracted hours lost due to staff absence, including sickness and stress. And when some of the staff are working so hard, when they are also being moved around from one department to another in order to cope with gaps elsewhere and facing that kind of stress and uncertainty, that does lead to higher levels of absence as well.
My right honourable friend, give way just one more time. I thank my right honourable friend for giving way, and I will try to be brief on this occasion. Mr. Speaker, I was recently contacted from Dewsbury Hospital. On any given day, the safe minimum staffing level in their A&E department, I understand, is 8 qualified nurses and 4 healthcare assistants or unqualified nurses. On this occasion, there was 3 nurses and 1 healthcare assistant. I think that speaks for itself, and clearly this will have an impact upon patient safety.
Yvette Cooper.
Well, my honourable friend is right that these are the sort of individual examples that we hear from our constituents now increasingly, both from staff and from patients. And I have heard from staff in intensive care, staff working in paediatrics, deeply worried about the pressures on them and the responsibility on them that if something should go wrong on their watch because they are understaffed, then they are deeply concerned that they will not be providing the care that is needed and are concerned about the implications as well. And overall, the Trust says their planning guidance is that they can cope with up to 22% of the contracted hours not being provided and still provide a safe service. Beyond that, it causes them significant problems delivering the right level of care. But overall, the gap isn't 22%. The gap is actually 26% for registered nurses and 30% for registered midwives. In A&E, on average, the shortfall is 30% on the contracted hours that they're wanting to provide. In children's services, again, a 30% shortfall. And in some wards, the proportion of temporary staff from agencies and the NHS Bank is also particularly high. In acute assessment wards, 20% of the nursing staff are agency staff. On the short stay wards, 11% of the nursing staff and 33% of the healthcare assistants are from agencies and from the bank. But it's not just about the pressures on nursing staff. And in fact, actually, for Mid-Yorkshire Trust, we talk to the senior staff at Mid-Yorkshire Trust, and they will say that they're doing a huge amount of work to try and address the nursing shortages, but actually they are more worried about the shortage of doctors, not just at Mid-Yorks, but across Yorkshire. According to the Royal College of Physicians, 14% of the consultant posts are vacant at Mid-Yorkshire Trust. In A&E and neurology, there is a particular problem, and there are regular and significant gaps in the contract rota for junior doctors. 15% of the acute medicine rota not filled by the contracted staff, 18% of the emergency medicine rota, 20% of the anaesthetist rota, and 20% of the surgery rota. So in practice, the Trust is having to fill those rotas either with consultant staff acting down and doing more junior posts in order to fill the rotas, or with locum staff. And it's that, or cancel operations, or turn ambulances away. And of course, Mid-Yorkshire Trust is committed to providing the best service that it can and not letting patients down. But of course, locum care means that medical staff don't have the relationships in place or the knowledge of the system to do the best possible job. And it costs far more too. So in the first 3 months of this financial year, because they can't recruit enough staff, contracted staff, the average spend on agency doctors was £1.5 million a month. And this is from a trust that, as we know, faces significant financial pressures. So what is Mid-Yorkshire Trust supposed to do? It is not just them. Across the country, 2 in 5 vacant consultant posts went unfilled last year, according to the Royal College of Physicians. Across the north of England, there are serious shortages of staff in our hospitals. And that is what we hear from our constituents. As my honourable friend has said, has talked about appointments cancelled or waiting times being affected. But one that particularly troubles me, we now have a 20-week wait for the pain clinic. And this is for patients who are suffering pain but who could get support and help with it and are having to wait 20 weeks in order to be seen at the pain clinic. And that is because of staffing problems. But what is the government doing about this? Too often, ministers are just shrugging their shoulders and thinking it is someone else's problem or that someone else will sort it out. I contacted the Secretary of State in 2010 and 2011 to raise concern that the training numbers being set at that time by the Yorkshire Deanery, particularly from A&E, were not enough and certainly weren't enough to meet rising demand at that time. But nothing was done. And given the rising scale of rising demand for healthcare and our ageing population, far too few doctors are still being trained, and there is a significant and serious regional disparity with bigger shortages in the North and the Midlands. And I have to say it's frankly incomprehensible that, given all of these pressures, the government would choose this moment to pick a major fight with junior doctors that ends up demoralising them or driving so many of them either to consider going abroad or to leaving the profession altogether at a time when we really need every doctor that we can get. And on nursing staff, the health department is also taking a massive risk, ending nursing bursaries, even though in an area like ours, that means a lot of people who could become great nurses will be put off because they are worried about the debts that they will incur and not being able to afford the training. And also, I have to say as well, refusing to give proper assurances to the thousands of EU citizens who work in the NHS, who often our trust have gone out to recruit because of the shortages at home and need assurances that they can stay and fill those crucial posts as well. The minister who replied to my honourable friend in her debate just a few months ago said then, within the current spending envelope, it is simply not going to be possible to achieve the numbers that we wish to see. And he was talking about nurse training. Well, that is not good enough. We need sufficient nurses, sufficient doctors to provide the care that our constituents need and deserve. And it can't simply be left to Mid-Yorkshire Trust or to any one individual trust across the country, because so much of this is linked, whether it is the training numbers that the deaneries decide, whether it is the decisions that the health department makes that have an impact on morale or pay or incentives right across the country, whether it's so many of those decisions, We need now to see a regional action plan to set out what the government is going to do and what NHS England is going to do to address these serious shortages across Yorkshire, to shortages both of nursing and shortages of doctors as well. Because unless something is done, then something serious is going to happen to patient care. I don't want to be warning again about this, just as we warned about this some years ago, and it still hasn't been sorted, because it isn't fair on patients across Yorkshire and across our area. In the case of the Fanshawe family, in the case of Edith Cunningham's case, she had family who stepped in, family who looked after her while she was in hospital. But there are so many more patients who don't have family, who can just fill the gaps, who can just step in. So for the sake of all of those patients and for all of those who all of us, I know on all sides of the House, will want to get the best possible care, I really, really urge health ministers to get a grip on this, get us the regional action plan we need before patient safety is affected. Hear, hear.
The Minister of State, Department of Health, Mr. Philip Dunn, to reply to the debate.
Thank you very much, Mr. Speaker. And if I may, I'd just like to start by my remarks by saying what a pleasure it is to be here this evening for my first opportunity at this batch box in my new role at the Department of Health. And I'd like to congratulate the Right Honourable Lady, Member for Normanton, Pontefract and Castleford, for securing this debate, a subject which I know is close to her heart and that of her neighbour, who it's good to see supporting her in the chamber this evening, and to congratulate her in particular for securing this debate, the last opportunity to raise the subject in the House this side of September. I'm well aware that this is a matter which is of significance to members of Parliament and obviously to the local populations that they represent. And I think the Honourable Lady for Dewsbury recently persuaded the Mid-Yorkshire Trust to have a public meeting to discuss these issues locally, and I congratulate her for doing that, and I hope that that was helpful in at least raising some of these issues. The problem of staff shortages in Mid-Yorkshire is well known, and it's recognised not just by local members of Parliament, and as was referred to by the Right Honourable Lady, it was demonstrated by evidence recorded by the Care Quality Commission through their inspections over recent years, not just the most recent one. But having said that, there are, of course, examples of good care within the Trust, and I would like to add my voice to that of the Right Honourable Lady, who acknowledged the comments from, I think she referred to the Fanshawe family, who pointed out that the quality of care provided by those nursing and other staff in the hospital is very high, where they're in a position to do so. But so I pay tribute to everyone who works in the Trust, in the hospitals there, for the admittedly somewhat challenging circumstances that they find. And I draw in particular attention to maternity services and children's services, where I think the standards are acknowledged to be high. But there's no hiding the fact, problems, and I'm not here to do so. Unsafe care was found in the most recent Care Quality Commission inspection last summer, which was published in December last year. And that's clearly the most potentially serious of their findings. And this is a long way from being a high-performing trust, which is what we would all like to see our trusts achieve. The CQC report shows that the Trust had responded to previous staffing concerns and is actively trying to fill posts. Nevertheless, there are acknowledged areas of significant nurse staffing shortage affecting patient care and treatment, particularly on the medical care wards and in community inpatient services and in specialist palliative care. Now, the Right Honourable Lady may not appreciate hearing this, but the fact remains that responsibility for staffing in the hospitals in her constituency does sit squarely with the board of the Mid-Yorkshire Trust, and the trusts have a duty to ensure that they have the numbers and the skill mix needed to deliver the quality care, patient safety and efficiency, taking into account the local factors such as acuity and case mix. I will.
But if there just aren't enough A&E doctors, or neurology doctors to fill the posts if they advertise them, if they charge around the country recruiting for them, and they still can't get the doctors in? What are they supposed to do?
So I'll come on to what we're trying to do nationally to make sure that we have an adequate number of trained professional clinicians to meet the needs around the country. It's important, I think, to recognise that while nationally some standards are set for safe staffing ratios, which were referred to by Honourable Lady for Dewsbury, these are not a hard and fast rule and never have been. They're guidance rather than statutory requirements, and this position hasn't changed. Trusts have to use their judgment and focus on the quality of care, patient safety and efficiency, taking into account local factors such as case mix rather than just numbers and staff ratios. So I would say it's not a case of meeting a particular staffing ratio or getting to a particular figure and thinking that the matter is resolved. There need to be enough staff, as both honourable members are saying, to meet the needs of the patients, and the judgment for that is in the hands of the clinicians on the spot. So nationally, the demands on our staff across the NHS are rising, as is known, and more patients are being cared for than ever before. And this is as true of Mid-Yorkshire as it is across the NHS. Last year, across the Mid-Yorkshire NHS Trust, 232,966 patients were seen, compared to 194,119 in 2009-10. So that's an increase of over 15% over the last 6 years. There were also some 4,685 more diagnostic tests carried out in May this year compared to May 2010. So activity levels are rising considerably. I'll give way to Honourable Lady.
Minister for giving way, and I also thank him for the constructive tone in which he is responding today. Does he recognise and acknowledge that the significant increase which has been seen in attendances is partly down to a crisis in primary care within the area, which is also struggling to attract GP and practice nurses, and therefore people are sometimes attending A&E inappropriately when they should have been seen in primary care?
I think it's well recognised across the country that attendances in A&E include a significant proportion of people who should not be at A&E, who should be dealt with elsewhere in the system. The reasons for that are legion. It's not all down to pressures on GPs. Much of it is down to the public increasingly seeing their hospital as the place to go. And we have a big educational job to do across the country, and frankly it behoves all of us to try and help relieve pressure on A&E by encouraging patients to go and get their health needs seen to by the most appropriate place, whether that's from a pharmacy through GPs or other community services. I'd just like to touch on the funding, which was a point raised by the Honourable Lady. It's not all about money, but money does play a part. And as a result of the funding settlement that we've secured for NHS England this year, I'm sure the Honourable Lady is aware that for 2016-17, the current fiscal year, Wakefield CCG will receive 488.8 million. That's a cash increase of just over 3% compared to the previous year. And in cash terms, that's £21.7 million increase, a significant increase compared to previous years. And for North Kirklees, which I think is the other CCG which uses the Trust or commissions work at the Trust, there was also an increase in the current year to £237.1 million, a 2.49% increase compared to 2015-16, or just a shade under £12 million. So that increase is substantially greater than the deficit reported by Mid-Yorkshire Trust for last year. Now, of course, the commissioning funds don't all go to the Trust, but the health economy in the area has received a significant cash injection. ensuring that we have the right number of nurses, if we can start with the nurses, is a vital move to achieve the government's objective of trying to move towards a fully seven-day NHS by 2020. And nationally, we already have 11,800 more nurses, midwives and health visitors since May 2010. The number of nurse training places has increased by 14% over the past 3 years alone, with further increases planned in the current year. Over 50,000 nurses are currently in professional training, which includes working and learning in hospitals through placements. But the current funding system means that 2 out of 3 people who want to become a nurse through an application to a university for a nursing degree are not accepted for training. And that's one reason, one of several, why trusts like Mid-Yorkshire find it difficult to recruit. In 2014, the last full year that I have the statistics, the universities were forced to turn down 37,000 nursing applicants. And as a result, the NHS suffers from limited supply of nurses and has to rely on expensive agency nurses and overseas workers, also referred to by an honourable lady. And this is one of the reasons why earlier today the government announced in its response to the public consultation on our plans to place trainee nurses on the same system as all other students, including teachers and doctors. And that report has been placed, the response has been placed in the Library of the House.
Minister, for his generosity giving way, could he confirm, though, the reason they were forced to turn down so many would-be nurses was because the government didn't fund enough places for those would-be nurses? And can I also, I realise he is obviously new into the department and will have not had a huge amount of time to investigate the staffing levels around Yorkshire, but I would urge him, when he goes back to the department, to look particularly at whether there could be a Yorkshire action plan on recruitment, because we have a regional problem that I think is worse than the national problem, although it will be replicated in other regions as well.
I will come to how we're going to respond to the honourable lady when I conclude my remarks, but I think she's quite right to point out that this is not a unique problem to this particular trust. It needs to be seen in a regional context. Yes, I do need to...
Thank you for your generosity. Just to let you know that the public meeting unfortunately didn't go ahead due to the tragic death of our colleague from Batley and Spen. But given the fact that the Mid-Yorkshire Hospitals is still undergoing a significant downgrade programme, which will see Dewsbury Hospital reduced to a minor injuries unit and many patients having to go to Pinterfield and Wakefield, will the Minister please look again at these plans in view of the staffing crisis?
The short answer is yes. I do intend to honour a commitment made to meet the local trust. I'd be happy to facilitate a meeting for the local MPs as well to talk about the reconfiguration plans that are afoot. I'm conscious that I'm in the unusual position in winding up an adjournment debate at this stage of the parliamentary calendar, in danger of running out of time. So I'm going to, if I may, just turn to the reconfiguration point before I conclude. I think we do have to look at the staffing issues wherever they are, at nursing or through the specialisations in the hospital that have been referred to earlier, in the context of the wider reconfiguration of services going on within the trust and through the sustainability transformation plans within the region later this year. The reconfiguration for the trust is driven by the need to address long-term systemic problems, some of which I've touched on. The current service changes were agreed back in 2013 and supported by the Secretary of State in 2014 following the advice of the Independent Reconfiguration Panel. Implementation of the agreed service changes at the Trust is a matter for the local NHS, and the local NHS is undertaking detailed work to assess fully the benefits and risks about bringing these changes forward. And this will look primarily at safety and quality, as well as capacity across the system, and take into account the views of local stakeholders. It will be the local commissioners who make the decisions as to precisely what is to happen. And it's for the local NHS to keep all service change under review in line with its role in ensuring that services provided are high quality, safe and sustainable. Staffing levels at the Trust, particularly in nursing, remain a concern, regularly identified by the Trust's regulators and commissioners, as I've already said this evening. The Trust has taken some action to address those concerns, including recruitment of additional nurses and non-qualified support staff, as well as strengthening of safe staffing policies and greater scrutiny at the board level. But it's clearly not solved the problem, as we've heard graphically this evening. More needs to be done. So the Trust believes that benefits could be realised in bringing forward implementation of the service changes with improved clinical safety, efficiency and patient flow. And I'm aware that concerns are being expressed at the knock-on effects of the proposal for changes nearby in Calderdale, which the Honourable Ladies will also be aware of, and that's currently under consultation. So change at each of these trusts should not be looked at in isolation, particularly in an area like this with so many interdependencies, challenging geography and local public transport. So following my predecessor, the Honourable Member for Ipswich's meeting with the Honourable Member for Dewsbury and the late Honourable Member for Backley and Spain early this year, he agreed to facilitate a meeting in September with the regulators, NHS Improvement and the CQC and the NHS providers and commissioners, and I will undertake to make sure that meeting goes ahead.
The question is that this House do now adjourn. As many as are of that opinion say aye. Aye. To the contrary, no. I think the ayes have it. The ayes have it. Order. Order.